Good morning, sir. I'm Hershey from BSN 3H, and now I will be performing how to administer oxygen by nasal cannula to the patient. So for the goal, the patient exhibits an oxygen saturation level within acceptable parameters. Equipment, check for oxygen delivery device as ordered by the healthcare provider. Oxygen tubing, consider extension tubing. Humidifier if indicated. Sterile water for humidifier. Oxygen source. Oxygen flow meter. Appropriate room signs. For implementation, bring necessary equipment to the bedside stand or over bed table. Perform hand hygiene and put on PPE if indicated. Identify the patient. Close curtains around bed and close the door to the room if possible. Explain what you are going to do and the reason for doing it to the patient. Review safety precautions necessary when oxygen is in use. Place no smoking signs in appropriate areas. Connect nasal cannula to oxygen setup with humidification. If one is in use, adjust flow rate as ordered. Check the oxygen is flowing out of prongs. Place prongs in patient's nostrils. Place tubing over and behind each ear with adjuster comfortably under chin. Alternately, the tubing may be placed around the patient's head, with the adjuster at the back of base of the head. Place gauze pad at ear beneath the tubing as necessary. Adjust the fit of the cannula as necessary. Tubing should be snug but not tight against the skin. Encourage patient to breathe through the nose with the mouth closed. Reassess patient's respiratory status, including respiratory rate, effort, and lung sounds. Note any signs of respiratory distress, such as tachypnea, nasal flaring, use of accessory muscles, or dyspnea. Remove PPE if used. Perform hand hygiene. Document. Put on clean gloves. Remove and clean the cannula and assess NIRS at least every 8 hours or according to agency recommendations. Check NIRS for evidence of irritating or bleeding. So let's start. Good morning, sir. I'm Regina Dula, your student nurse for today. Bigyan ko lang po kayo ng oxygen niyo para po makahinga po kayo ng maayos. Ano po ang pangalan niyo, sir?
Makmak.
Okay po, Sir Makmak. Kumusta na po, sir, ang pakiramdam niyo? Sir, naglakad na po kayo ng oxygen. Ano po, sir, ang prepare niyo? Ano po, sir?
Kahit ano.
Ayos lang po ba sa inyo? Ayos lang po yung sikip niya, yung luwa. Wala po. Sir? Sir, pag may nangyari
nararamdaman po po kayong iba, call lang po kayo sa nurse station. Thank you so much.